So we have Mr. Brown, he's 50 years old, status post-pneumonia. The patient has coarse crackles, a lot of thick green secretions. He has a weak cough and is on a 4-liter nasal cannula starting at 94%, and he has been suctioned many times and will likely need more. Perform oral and nasal tracheal suction. What else can you do to help? So we can put in a nasal trumpet to help. So what I'm going to do is I'm going to check the patient's chart. The indications are that he has thick green secretions and he has coarse breath sounds. We're going to make sure he has no contraindications, which would be that he has had an acute facial, neck, or head injury, or he has a low platelet count. He has neither of those. So I'm going to go ahead and wash my hands. Wash my hands, put my gloves on. Okay, once I have my gloves on, I'm going to make sure I have all of my equipment. So I have my pulse ox in my pocket, I have my stethoscope, I have the suction catheter, I have my lube, I have my sterile water, I have sterile gloves. So I'm going to go ahead and say, hello Mr. Brown, my name is Taylor, I'm going to be your respiratory therapist for today. Can you give me your name and date of birth? Okay, sounds good. So it looks like that you're having some coarse breath sounds and some thick, nasty secretions. So today we're going to be suctioning you to get those out. I see that this has been done a lot of times, so your doctor might recommend putting in a nasal trumpet so we don't go in as many times and hurt you. The procedure will hurt just a little bit, but it'll last no longer than 30 seconds because we go back twice for 15 seconds. So what I'm going to do is once I have all of that and I've explained the procedure to him, I'm going to put the pulse ox on him. And I also have my yank hour for his oral suction. So I put the pulse ox on him. I'm going to listen to breath sounds in 6 different places. Okay, so he's starting at 94% on a 4-liter nasal cannula. His breath sounds do confirm that he sounds coarse and crackly. His color, he's looking a little bit pale. Do you get tired when you walk around trying to go to the bathroom? Okay, so he does have a little bit of dyspnea. His respiratory rate is 18, and yeah. So now what I'm going to do is I'm going to go ahead and open up my sterile gloves so we can start the procedure. So what I'm going to do is I'm going to put one sterile glove on one hand just so I have my free hand to grab the equipment that I need. Well, before I put on my sterile gloves, I'm actually going to open this up and fill up my water pouch so I can make sure that my catheter is working right and flush it if needed. So got my sterile water. Put just a little itty bitty bit in there. Okay, got that. Got my sterile water. I got my suction catheter right here. Okay, so I got my sterile glove on. Got that on. So what I'm going to do now is I'm going to take the catheter that is sterile, grab this, then wrap this in my hand, put this in there, there we go. Now I have this, I have lube. I'm going to spray a little bit of lube out. Put this in the lube, get it all lubed up. Alright, then my suction is turned on, but for 120 for 120 to 150 for my negative pressure. So I'm just gonna make sure it works. Looks like it works good. So first I'm going to take his nasal cannula off. Just tell him what we're gonna do is pre-oxygenate him. So I'm gonna keep the pulse ox on him the whole entire time, just to make sure he stays static pretty good. So I'm gonna just leave this on for like 5 minutes. You don't have to squeeze it because it has oxygen. Looks like his stats are coming up. He's now at 100%, so I'm going to say, okay, Mr. Brown, what we're going to do now is I'm going to put this down your nose. Ready? almost there, we're almost there. And then pull out. Trying to rotate it while I pull out. Okay, good job. So then, do it one more time.
Wash my hands.
One more time.
Chart the patient, chart quantity, quality, color of the scanners, and then I'm going to tell the doctor that.
Good job, Mr. Brown. Okay, now that we're done with that, I'm going to take this off, put my yin gower on, put his nasal cannula back in. And then I'm just going to follow the sides of his mouth in front of his teeth, just so he doesn't try to choke on it. There we go. Sounds good. So we've finished suctioning. He has done good the whole time. His stats have stayed up. Now that he's back on his nasal cannula, he's coming back down to 94%. So put this back on, make sure it's good and comfortable. And then I'm going to listen to his breath sounds again.
And she wouldn't, so I just kind of walked over because yeah, so just remember, since we don't have the actual section, you have to tell me what pressure you have.
Okay, once I've listened to his breath sounds, I can hear that they've cleared up a little bit. I ask him how he's feeling. He says it hurt, but he's doing a little bit better. He's still kind of pale. Dyspnea, he hasn't gotten up, so we really don't know yet. The respiratory rate is now up to 21 just because he was breathing fast, but he's doing better. So what I'm going to do now is clean up my material. Leave his yin gower, tell him if he needs to suction inside his mouth, he can. That's right there for him. Clean this up. And then what I'll do is I'll ask him if he needs anything else before I go. If he says no, that he's good, I will take my gloves off. Wash my hands, chart how the suction went, how much I got, the color, stuff like that, and yeah, thanks.